Good morning to everyone. I'd like to welcome you all here today for this Civil Society Forum on the Task Force on Innovative International Financing for Health Systems. Particularly like to thank those of you who have travelled some distance to be here with us today.
The High-Level Task Force on Innovative Financing for Health System was set up last September by Prime Minister Mr. Gordon Brown and President Bob Zoellick of the World Bank. This is a very important task force. The objective is to raise additional money to complement ODA and domestic financing with the objective to scale up the achievement of Millennium Development Goals, especially Goals 4, 5 and 6.
It's absolutely critical that now we maintain our commitment to the Millennium Development Goals, because there is a tendency, a danger, that there will be some serious backsliding from the pledges that have been made. I'm a member of the European Parliament and I follow the pledges and promises that 27 member states have made. I feel very strongly that now is not the time to backslide, not the time to stop being committed to the MDGs, but rather to galvanise ourselves to do more, to ensure, as Gordon said on Monday in the conference in London, that we would maintain our budgetary commitment to meeting those goals which will eradicate poverty.
We are meeting in London today to look at some of the recommendations coming out from the two working groups. The first working group is to look at what are some of the constraints in the health system and what kind of financial gap we need to raise in terms of money to fill that gap. The second group is providing us with recommendations on the innovative financing mechanisms. Clearly, the task force members need to listen to the reports from those two working groups, and we will provide them with advice and guidance for further work to be finished as soon as possible, and we expect the result to be ready so that the results and the recommendations can be fed into the G8 meeting in Italy in July.